This vitamin reverses nerve damage. After 60, doctors rarely explain it. If you are over 60 and you have started noticing burning in your feet, numbness in your toes, tingling in your legs, or a strange feeling like you are walking on cotton, this is not something you should ignore. Many older adults assume these symptoms are just a normal part of getting older. They think weak legs, numb feet, poor balance, and nerve pain simply come with age. But that is not always true. In many cases, the real cause is something doctors may not fully explain during a short visit. And if it is missed for too long, it can quietly damage your nerves more and more over time. The vitamin we are talking about today is vitamin B12. And for many adults over 60, low vitamin B12 can play a major role in nerve problems, fatigue, memory changes, poor balance, and even weakness in the legs. In some cases, when the deficiency is identified early and treated properly, nerve symptoms can improve significantly. That is why this topic matters so much, because if the problem is caught in time, some of the damage may be slowed, reduced, or even partially reversed. Now let us be clear right from the beginning. This is not a miracle promise. Not every case of nerve pain is caused by vitamin B12 deficiency. And not every case of long-term nerve damage can be completely reversed. But if your symptoms are linked to low B12 and you correct that deficiency properly, your body may have a real chance to recover. That is the part many older adults never hear clearly enough. So what exactly does vitamin B12 do? Vitamin B12 is essential for your nervous system. Your nerves rely on healthy protective coverings, often compared to insulation around electrical wires. Without enough B12, that protective system can weaken. When this happens, nerve signals may slow down, misfire, or stop working the way they should. That can lead to numbness, tingling, burning sensations, weakness, poor balance, and trouble walking. In other words, your body may still be trying to send signals, but your nerves are no longer delivering them properly. That is why vitamin B12 deficiency can feel so confusing. One person may feel tired all the time. Another may lose balance when walking. Another may have pins and needles in the feet every night. Another may notice memory fog or mood changes. It does not always look the same in every person. And that is exactly why it gets missed. After age 60, the risk goes up for a very simple reason. Your body may not absorb B12 as well as it used to. Even if you eat eggs, meat, fish, or dairy, your body still has to break down the food, release the vitamin, and absorb it properly. That process depends on healthy stomach acid and a special protein called intrinsic factor. As people age, stomach acid often drops. Many older adults also take acid-reducing medications for years. Others take diabetes medication, like metformin, which can also affect B12 levels over time. Some have digestive conditions. Some have had stomach or intestinal surgery, and many simply do not absorb nutrients as efficiently as they once did. That means you can still be eating foods that contain B12 and yet slowly become deficient anyway. This is one of the most important things seniors need to understand. A deficiency does not always mean you are eating badly. Sometimes it means your body is no longer pulling the nutrient in the way it should. So if you are over 60 and struggling with unexplained nerve symptoms, do not assume your diet alone tells the whole story. Now let us talk about what nerve-related B12 deficiency can actually feel like. It often starts quietly. Maybe your toes feel a little numb. Maybe you notice tingling in your feet at night. Maybe your legs feel weak for no clear reason. Maybe you feel unsteady when getting out of bed. Some people say it feels like their socks are bunched up under their feet when they are not. Others describe burning soles, stabbing sensations, or a buzzing feeling in the lower legs. Some feel clumsy. Some start avoiding stairs because they no longer trust their balance. Others feel exhausted all the time and cannot explain why. And the frightening part is that these changes usually come on slowly. Because they arrive gradually, people adjust to them instead of questioning them. They say, "I guess I am just getting older." They stop walking as much. They hold the wall a little more. They sit down more often. They avoid going out at night. Their world becomes smaller, and they do not always realize why. What began as a vitamin issue slowly starts affecting independence. This is why early attention is so important. Vitamin B12 deficiency does not only affect nerves in the feet and legs, it can also affect the brain and blood. Some people become forgetful. Some feel mentally slow or foggy. Some become more irritable or low in mood. Some feel unusually weak or pale because B12 also helps the body make healthy red blood cells. In more advanced cases, people may have significant balance problems, confusion, and serious neuropathy symptoms. So this is not a small issue. It can affect energy, movement, memory, and quality of life all at once. So why do doctors rarely explain it well? To be fair, many doctors do know about B12 deficiency. The problem is often not lack of knowledge. The problem is time. Older adults often come to appointments with 5 or 6 concerns at once: blood pressure, blood sugar, sleep, joint pain, swelling, stomach issues, fatigue, medication refills. In that short visit, numb feet may get mentioned only briefly or not at all. The patient may not describe the symptoms clearly. The doctor may focus on the most urgent issue first. And unless someone specifically thinks about B12, the connection may never get fully explored. Another reason is that nerve symptoms have many possible causes: diabetes, poor circulation, spinal problems, medication side effects, thyroid disease, alcohol use, kidney disease, and other vitamin imbalances can all play a role. So B12 is just one piece of a much bigger puzzle. But that is exactly why it should not be forgotten. Because unlike some other causes, B12 deficiency is often treatable. And that brings us to a critical point. If you are over 60 and you are experiencing numbness, tingling, burning feet, weak legs, poor balance, unusual fatigue, or brain fog, you should ask your doctor directly whether vitamin B12 deficiency could be part of the problem. Not someday, not months from now. Ask about it specifically, because one of the biggest mistakes seniors make is assuming their symptoms are too minor to mention. Another common mistake is blaming everything on poor circulation. Yes, poor circulation can cause cold feet, cramps, skin changes, and leg discomfort. But numbness and tingling are often more closely tied to nerve issues than people realize. And when the nerves are the real problem, circulation supplements and home remedies alone will not fix the root cause. Now let us talk about who is most at risk. Adults over 60 are already in a higher risk group simply because absorption tends to decline with age, but some people face an even greater risk. Vegetarians and vegans may not get enough B12 from food because it is found mainly in animal products. People taking metformin for diabetes may gradually develop lower levels. People who regularly take acid-reducing drugs may not release B12 from food efficiently. Those with digestive disorders, prior stomach surgery, or chronic gut problems may absorb less. And older adults with limited diets, poor appetite, or ongoing weight loss may also be vulnerable. If you fit into one or more of these groups and you are also having nerve symptoms, B12 should absolutely be on your radar. Now here's the part many people want to know most. Can B12 really reverse nerve damage after 60? The honest answer is this: it can improve nerve-related symptoms when B12 deficiency is the cause, especially if treatment begins early. That means numbness may lessen, tingling may improve, energy may return, balance may get better, walking may feel more stable, mental clarity may sharpen. But recovery depends on how long the deficiency has been present, how severe it is, whether the cause is truly B12, and whether there are other problems involved as well. If the deficiency has gone on for years, full recovery may be harder. But even then, correcting the deficiency can still help prevent things from getting worse. This is why waiting is so dangerous. Nerves do not like to be neglected. The longer the deficiency continues, the greater the chance that the damage becomes harder to undo. That is why an older adult who acts early may see meaningful improvement, while someone who ignores symptoms for a year or two may struggle much longer. And there is something else people often misunderstand. Improvement does not usually happen overnight. Some people notice more energy within weeks. Others say their mind feels clearer first. But nerve symptoms like numbness, tingling, and burning often take longer. In some people, improvement may unfold over months. That means patience matters, follow-up matters, and consistency matters. You do not take one dose and suddenly wake up cured. Your body needs time to rebuild and recover. Now let us talk about testing. Doctors often begin with a blood test to check vitamin B12 levels. Sometimes they also look at a complete blood count because B12 deficiency can affect red blood cells and contribute to a certain type of anemia. In some cases, if the B12 level is borderline or symptoms are strong, additional tests may help clarify the picture. But the most important thing to understand is this: symptoms matter. A number on a lab report is useful, but the whole story comes from both the blood work and the patient's real-life symptoms. That is why you should describe your symptoms carefully. Do not just say, "My legs feel funny." Be specific. Say whether the numbness is in both feet or only one. Say whether it gets worse at night. Say whether you feel burning, weakness, loss of balance, or difficulty walking. Say whether you have fatigue, memory changes, or mood changes too. The clearer you are, the easier it is for your doctor to connect the dots. Now, let us discuss treatment. If B12 deficiency is confirmed or strongly suspected, treatment may involve oral supplements, sublingual forms, or injections depending on the situation. Some people absorb oral B12 well enough, others do not. In more severe cases, especially when nerve symptoms are prominent, injections are sometimes used because they bypass absorption problems in the digestive system. The right approach depends on the individual. That is why random self-treatment is not always the best plan. Many people buy a general multivitamin and assume that should be enough. Sometimes it is not. A standard multivitamin may contain only a small amount of B12, and that may not be enough to correct a real deficiency. On the other hand, taking large doses without understanding the real cause of your symptoms can also create confusion. If the issue is actually diabetes neuropathy, spinal compression, or another medical condition, you may waste valuable time. So, the goal is not blind supplementation. The goal is targeted treatment. Now let us look at food sources. Vitamin B12 is found naturally in fish, meat, eggs, dairy, and liver. Some cereals and fortified products may also contain added B12. These foods are helpful, and a balanced diet matters. But remember, in older adults, the issue is often absorption, not just intake. So eating more B12-rich food may help some people, but it may not fully correct the problem if the digestive system is not absorbing it well. That is another reason testing and follow-up are so important. There are also warning signs outside the legs and feet that people overlook. For example, some older adults with low B12 feel strangely weak, even though their muscles seem normal. Others become short of breath more easily during simple activity. Some develop a sore tongue, mouth discomfort, or pale skin. Some become unusually forgetful or mentally sluggish. Others describe a loss of confidence while walking because they no longer trust what their feet are feeling. These symptoms may not all happen together, but when several show up at once, they should never be brushed aside. Now let us go through the most common mistakes seniors make with this issue. Mistake number 1, assuming numbness is just old age. Mistake number 2, focusing only on calcium and vitamin D while completely ignoring nerve health. Mistake number 3, blaming every foot symptom on poor circulation. Mistake number 4, starting random supplements without checking medications, symptoms, and possible causes. Mistake number 5, never mentioning mild symptoms to a doctor because they do not seem serious yet. Mistake number 6, stopping treatment too early because they feel a little better. Mistake number 7, failing to monitor balance and fall risk while symptoms are ongoing. These mistakes are common, but they can be costly. Because when your feet lose sensation, your risk of falling can rise. When your legs weaken, daily life becomes harder. When your balance slips, confidence drops. And when confidence drops, people move less. That creates another problem altogether. Less movement leads to more weakness, poorer circulation, stiffer joints, and lower energy. The cycle feeds itself. So if you are treating low B12, support your recovery with smart daily habits. Stay hydrated, eat enough protein, keep blood sugar under control if you have diabetes. Wear supportive shoes. Avoid excessive alcohol. Move your body gently and regularly. If your balance is shaky, make your home safer by removing loose rugs, improving lighting, and using support rails if needed. Check your feet every day if you have numbness, because reduced sensation can make it easier to miss injuries. These steps do not replace treatment, but they support it. Now here is another important truth. Not all numb feet are caused by vitamin B12 deficiency. This matters because some people hear about B12, start taking supplements, and assume the problem is solved. But weak legs and numb feet can also come from nerve compression in the back, diabetic neuropathy, vascular disease, side effects of certain drugs, thyroid problems, or even too much vitamin B6 in some cases. That is why B12 should be considered seriously but not blindly. It is one possible cause, not the only cause. Still, when B12 is the missing piece, finding it can be life-changing. Imagine an older adult who has been slowly losing confidence for a year. They avoid walks because their feet feel strange. They hold furniture when moving around the house. They stop going out alone. They feel tired and foggy. Everyone around them assumes they are just slowing down because of age. Then the deficiency is found. Treatment begins. Over time, energy improves. The burning decreases. The walking becomes steadier. Maybe they are not exactly the way they were at 40, but they are far better than before. That kind of improvement matters. It means more freedom, more safety, and more dignity. And that is what this conversation is really about. Not chasing a miracle, not promising the impossible, but refusing to ignore a treatable cause of suffering. If you are listening to this and thinking, this sounds like me, then let this be your wake-up call. Pay attention to your body. Pay attention to sensations in your feet and legs. Pay attention to the way you walk, the way you climb stairs, the way you feel when you first stand up. If something has changed, do not dismiss it too quickly. Let us also talk briefly about when symptoms may be urgent. If numbness comes on suddenly, if one side becomes weak, if you develop slurred speech, if you lose bladder or bowel control, or if severe back pain comes with rapidly worsening leg weakness, that is not a wait-and-see situation. Those symptoms need urgent medical attention. A vitamin deficiency is not the only possible explanation, and some causes can be serious emergencies. But for the slower, creeping pattern many older adults experience, B12 deficiency remains one of the most important hidden causes to rule out. So what should you do next? Start by making a simple list of your symptoms. Write down when they started. Note whether the problem is in both feet or one. Does it happen mostly at night? Is there burning, tingling, weakness, or poor balance? Then make a list of your medications, especially if you take diabetes medicine or acid reducers. Bring both lists to your next appointment and ask directly whether vitamin B12 should be checked. That one conversation could change everything. And if a deficiency is found, take it seriously. Follow the treatment plan. Keep your follow-up appointments. Give your body time. Recovery is rarely instant, but steady improvement is possible. The sooner you act, the better your chances. Aging does bring real changes. That is true, but not every symptom should be accepted as just getting older. Sometimes the body is not simply aging. Sometimes it is lacking support. Sometimes the nerves are struggling because they do not have what they need. And sometimes that missing factor is a vitamin many people rarely think about until the symptoms become impossible to ignore. Vitamin B12 may not be flashy. It may not be trendy. But after 60, it can become critically important. So if your feet feel numb, if your legs feel weak, if your balance is getting worse, or if you feel like your body is sending warning signals you do not fully understand, do not brush it off. Ask questions. Get checked. And remember that when vitamin B12 deficiency is the cause, treatment may do far more than you expect. It may not just support your blood, it may protect your brain, it may strengthen your balance, and in the right case, it may help your nerves recover before the damage goes too far. That is why this vitamin deserves far more attention than it gets. And that is why adults over 60 should never ignore the signs. Because sometimes the difference between decline and recovery starts with one simple discovery. Your nerves were not failing because of age alone. They were crying out for vitamin B12.